So we have several new things that have occurred over the last few months. We recently got our accreditation from ACEN. So we had no areas of concern. We will not have another site visit or review until 2030. We also got news from the Texas Board of Nursing to approve 2 new curriculums for both our ADN Associate Degree Nursing Program and the VN Vocational Nursing Program. And then the best news that we have so far is that our December graduates have a 100% pass rate. So we are 100% on our NCLEX pass rate so far for 2023.
Tell me about the accreditation, what all that went through to get the accreditation.
Sure. So for a nursing program, it's like quality standards. It's just a great key indicator to show that our program is accredited. And it is a very lengthy process. So there are, a self-study has to be done. There are several documents that have to be put together, and then we submit all that. They come for a 3-day site review and validate all of our curriculum and faculty and files, interview students, interview the public. It then goes to their Board of Commissioners, and then they review and determine if we can continue our accreditation.
And with that accreditation, with y'all being with the accreditation, you're good to 2030 now?
Yes, sir.
Okay. What does that mean to know that for 7 years that we're good for 7 years?
So what that implies is that for anybody interested in going to Kilgore College Nursing Program, we are fully accredited with no areas of concern, and we have been given a gold seal, if you will.
And tell me about the new curriculum that you're adding.
So I am new to Kilgore College. I came in the summer of 2022. We did not have a good or successful pass rate, and so my first assessment was to look at our curriculum of both of our programs. Did that, met with the faculty, and we elected to change up the curriculum and go back to a traditional or otherwise block curriculum. That requires a proposal to the Texas Board of Nursing, as well as to Kilgore College, and then also to ACEN, our accreditors. And so with that, we did all of that legwork, put the proposal together, and all 3 entities have blessed us to change up the curriculum starting in the fall.
And how is that change going to, what is it going to involve?
So currently, most of the ADN programs here in the East Texas area are on a concept-based curriculum. Which is and has been since 2015. We are now going back to, for some of us older nurses, what we call traditional. That traditional or block curriculum is exactly what the baccalaureate programs are on. So we are going back to that curriculum that our current BSN programs utilize.
Okay. Let's see, what was the last one you told me?
Our NCLEX pass rates?
Yes.
So the graduates that were in the fall of 2022, there were 24 of them. They all successfully passed the NCLEX, or their licensing exam, on their first attempt, which then gives us the 100% pass rate for boards, which is an outstanding accomplishment. And so we are proud of those and looking forward to continuing 100% pass rate.
In such a short time, you've been able to revamp the nursing program here at Kilgore College to get it to the standards that you yourself would like to see. What does that mean to you to see these changes come about?
It's very overwhelming. We have done a lot of work of enhancements and improvements over the past 11 months, if you will. That is from changing up the curriculum, raising the bar and level of expectation, making sure that the graduates from our nursing programs are quality-based, professional, and accountable for their actions. And it's a huge accomplishment for everything that we've done in a short period of time. It is not typical for a new program director to undergo an accreditation visit, a Texas Board of Nursing site visit, 2 curriculum changes, and many other things for that matter in just a short period of time.
And also with the shortage of nurses, always seem to be a shortage of nurses, not just in the East Texas, but also in the United States. With the shortage of nurses and having this program, at the height that it is, getting back to the being at the height it is, being one of the most successful programs here in the state of Texas. What is that? How does that attract students?
So obviously we do have a nursing shortage. The pandemic did not make nursing very attractive for the public. However, it is one of the most highly respected professions. We are doing our best to attract those students or anyone actually who is interested in helping and serving others. With everything that we have been working towards, it is an opportunity for those to look at Kilgore College as an opportunity to get their nursing license. And then we also offer a transition program, so you can go from your associate's degree, or excuse me, licensed vocational nursing into your associate's degree. And then we also have articulation agreements with UT Tyler and some of the other baccalaureate programs for them to pursue their BSN at a later time.
With y'all going back to the, as you said, the old traditional type, is are you going to see like a lot of nurses who instead would just get their associate's nursing? You see them going towards their baccalaureate now?
I think it's all up to the individual and what they have going on in their life. An associate degree is a great way for you to get your license, begin working. And then if you are interested in pursuing your education or furthering your education, then you have the opportunity to get your baccalaureate degree online. There are many programs that offer an RN to BSN program, and we're excited to be able to offer the first licensing step to get to a further nursing career. Kilgore College Health Sciences is looking forward to a new building coming up in the spring of 2024. So the nursing program will have a new state-of-the-art simulation lab as well as skills lab. That provides a great hands-on learning experience for our students. We will have all of the same technologies that the hospitals have, so that when they are in the lab, once they go into the acute care setting, it won't be anything that they haven't seen before. It's a great strategy for students to have an opportunity to practice before they get into the true real life experience of a hospital setting.